Hey friends, it's Dr. Amy, and I am excited to introduce my guest today, Dr. Sheilagh Maguiness. As you know, February is about our month for connecting with teens in the lives of being connected champions in the lives of children. So let me introduce my guest today. Dr. Sheilagh Maguiness is the co-founder at Stryke Club. She's also a dermatologist and entrepreneur. A double board-certified dermatologist and pediatric dermatologist with a busy practice in Minneapolis, Minnesota. She currently serves as the president of the Society for Pediatric Dermatology. She's also the mom of two tween boys and the co-founder of Stryke Club, which we'll get into, but it was a personal care brand made just for boys. Dr. Sheilagh is passionate about education and prioritizes teaching with every patient encounter. She strives to educate the next generation of dermatologists and pediatricians in her practice and teaches families and caregivers through content created for national pediatric and dermatological societies and her social media presence. We will talk all about the ways to get in touch with Dr. Sheilagh, but that's your professional bio, Sheilagh. What else do you want people to know about you or what you're doing in the world?
Well, thank you, Amy, for that lovely introduction. So, I am a pediatric dermatologist, and I like to start by explaining to the listeners that pediatric dermatology even exists as a subspecialty, because I think so often, even my peer colleagues might not even know that pediatric dermatology is a board certified subspecialty of dermatology. So, I've done extra training after a dermatology residency to learn how skin conditions and diseases show up on children, all the way from newborns to young adults. So that's the first thing. The second is that I'm a busy mom, so multitasking, trying to get it right for my two tween boys who were the inspiration for my foray into the entrepreneurial world with developing Stryke Club. So lots of hats I'm wearing these days, but boy, really fun to have a busy academic practice and then a creative side to some things that I'm doing too.
Yeah, so tell us a little bit more about how you got into this entrepreneurial side with Stryke Club. What is Stryke Club and what has it meant for you?
So, Stryke Club is a personal care and hygiene brand really tailored toward teen boys. Anyone can use the products. In fact, I love them myself because I personally formulated them. I know what's in them, I know how they work. But really, the point of the company is to kind of meet teen boys where they are and give them effective tools to take care of themselves.
Mhm.
Our journey started back in late 2019 when a friend of mine came to me having noticed that when she went into all of these drugstores or Target looking for products for her teen boys or tween boys that were just starting to struggle with all of the changes that are happening in that pre-pubertal time and even during puberty, and came up empty-handed, looking at a sea of skincare products that were very pink and fruity and clearly being marketed heavily to girls, or that were, medicinal and products from the 80s that or 90s that we used when we were growing up for things to address needs like acne. And so therein lied this white space where, my company was founded by four moms, all of us, looking for a potential solution for our boys. And we kind of knew that we could do something better. And as a mom, a dermatologist, and, of course, a mom of boys, this really resonated with me. And I kind of knew exactly what I wanted the products to do and how I wanted them to work in the lives for boys. So
Mhm.
that's kind of the start of Stryke Club.
I love that so much. Thank you for sharing. My listeners know that I also have two teenagers. I have a 16-year-old boy and a 19-year-old girl. And I couldn't agree more that when we look at the market of skincare products, it really is aimed at girls. And as we know, as women, aimed at women as well. So we can't talk about boys' skincare and whatnot without talking about girls, and we can't talk about either without talking about self-confidence, right? What did you notice and what do you notice in your practice about how our skin affects how we feel about ourselves?
Oh, Dr. Amy, you're hitting the nail right on the head because it's very well established in quality of life studies and, dermatology research that inflammatory skin disease, of which acne is one, has an immense impact on things like depression, anxiety, and overall mental health. And that, of course, plays into self-esteem and self-image. And in the teen years, at a time when all of those things are just forming and kids are so vulnerable. So you're absolutely right. A child with severe acne is more likely to struggle with depression and anxiety.
Mhm.
And those are the kids that come into my office and I see them clinically. In particular, the boys, they'll come in with a little bit more severe acne just from the hormonal component. A lot of the testosterone kind of makes acne worse for boys and a little bit more severe. But on a lot of times, they will come in head down, wearing their hoodie,
Mm,
not really making a lot of eye contact. And you can already see how being a teenager is hard enough, but having a severe inflammatory acne outbreak can just really impact a teen's developing self-esteem. So really important for me as a doctor to address it clinically. What can we do for our teens from a clinical standpoint and get it treated? And then as a mom, looking at my two tween boys, how do we start this conversation about maybe healthy skincare and hygiene habits early? Let's talk about being champions for our body and our skin and how to have that conversation as a parent or caregiver, and then kind of give the kids the tools they need to do this easily and safely.
mhm. You know what I find in my work with teen boys who are amazing, by the way, I love teenagers, um, is, there's this message to them that they shouldn't really care about their appearance. It should just be seamless and they shouldn't put a lot of time into it. And, it should just like kind of come naturally to them. Whereas like we really do socialize girls to take care of their skin, to take, you know, put time into makeup and appearance and whatnot. What do you say to parents of teen boys who might be listening or other professionals who are working with teen boys about how important it is to also validate this for them?
Oh my goodness, of course. Boys care. Boys do care, but you're right. We are socialized that there is a stigma around self-care for boys. It's not masculine enough. It's not macho to really care about their appearance or be seen to be caring about it and doing a good job that way. But as parents and caregivers, this is a great opportunity for us to normalize it. Let's talk about how we had acne, how we know how they might feel. Bring it up as a topic of conversation, not to point it out in a negative way, but just say, oh, I see that you might have, a little bit of a breakout right now. Let me tell you, when I was a kid, I did too. Let's go and see what kind of things we can do to address this. And whether that means just a trip and an opportunity to go to the store with your child, or if it's something more serious and you're seeing a lot of inflammation and scarring, helping them to normalize going and seeing their pediatrician or dermatologist about it, because boys do care.
Mhm.
But yet, you're right. The market out there is really aimed towards girls and getting girls to do more. And the targeting that's happening in social media for girls is also not exactly great either. It's a little bit negative, this whole idea of celebrity children doing like a 20-step skincare routine with really expensive products aimed at adult skin. So on the one hand, we have all these girls using kind of too many things. And a lot of times in my clinic, it's the girls that I'm saying, hey, you know what? We need to simplify. This is too much. Pull it back. You're going to damage your skin barrier with all these active ingredients. And the boys, I'm saying, hey, you know what? I see you care. We are going to get through this together. Let's build a plan for you.
Yeah. I love the idea of assuming that they care because I think there's no other group of kids birth to 18 that I see that are misunderstood other than teenagers, right? Tweens and teenagers as kind of not caring and hard to reach, but they really care a lot. The other thing that I hope the listeners are hearing from you, Dr. Sheila, is like autonomy, right? Giving them some choice in this. So like I remember with my own son when he started having some acne, I said, let's just look at the aisle of skincare in the store and like, is there anything that appeals to you? Is there anything you've heard about? Is there anything you'd be willing to try? And it didn't mean that I didn't have thoughts or ideas or opinions about it. It means that teenagers need to have autonomy, right?
Mhm.
And then the next step is, hey, if you want to try a product, let's try it. I also want to let you know that if it doesn't work, there are specialists, right? That can do this. Just like I would take you to a specialist if you hurt your knee or you needed your tonsils out or anything else. There's specialists that can help with this. And that allows them to be curious about their own health care, which I think is the beginning of really good self-care.
I totally agree.
Yeah, yeah. So let's make sure that we don't ignore girls entirely here. You mentioned the boys coming in, hooked up, kind of feeling, cruddy about themselves, but really caring. What do you notice about girls who are having a tough time with their skin or skincare?
Well, I mean, obviously, 90% of the teens get acne, so I will see a lot of girls in my practice too. And like I mentioned before, a lot of the times it's the girls that are doing, a multi-step skincare regimen. They have seen a ton of different products. They have bought a ton of different products. They'll bring in a bag of everything that they're doing. And a lot of times with them, I'm paring down and then addressing, if they have more severe acne, inflammatory, do we need to be walking up that treatment ladder?
Mhm.
But it is really different in how boys and girls are being not only targeted, by marketing campaigns of these big skincare companies, but also in the way that they will or won't engage. And part of that is what they feel they have been given license to or allowed to.
Mhm.
Girls feel like they should be doing this. It's something that's expected. And boys, like we've mentioned, feel that there's a lot of stigma around this and that it's not masculine.
Mhm.
So a lot of times, even though the treatments are the same, the approach that I take with boys and girls is a little bit different.
Yeah, absolutely. And so I want our listeners who are many healthcare professionals that listen to also just remain curious, right? Ask questions. I love the idea that somebody's bringing in their whole skincare regimen to you and like dumping it on. I imagine them like dumping it out on the exam table and
It's
saying like,
helpful. It's very helpful because
yeah.
sometimes you don't know. And if you don't ask, even as the mom or a doctor, sometimes you're surprised because boys haven't necessarily been given the same kind of license or tools or agency that girls have already been given.
Mhm.
And they say they're washing their face in the shower, but you'll be surprised if you ask them what they're using to wash their face. It might be shampoo. So you really just
Yeah.
have to like dig in and ask the questions.
And the last thing your teenagers want to talk to you about is what they're doing in the shower, let's be honest.
Totally. Yes.
So what I'm hearing from you really clearly is we need to give boys license to care and to have some autonomy about their skincare, and we need to allow girls to pull back a little bit and really look at the messaging they've been giving, or
Completely.
and so that they can have, a little bit more autonomy with their skincare as well. Um, I want to underscore a fact you just kind of breezed by, just so everybody hears it again. 90% of teenagers have acne and skincare problems, right? So
Yes.
I think whatever they're seeing on social media is a lie because everybody on social media looks curated and beautiful and made up. And would you speak just a little bit about what they're seeing in terms of appearances?
Oh my goodness, you couldn't be more right. It is the selfie generation, isn't it? It's like there's a filter for everything. What you see on social media, and I think that teens are more and more maybe getting this, but it can be really difficult. It's not real life. There have been people are carefully curating what you see in terms of how they look, what their appearance is. Even now there's artificial intelligence ways to put out like different photographs of yourself in different lights. So what you're seeing isn't always true.
Yeah.
And even if everyone looks perfect on social media, of course, we know that that is not the case in real life.
Mhm.
Everybody at some point in their life will struggle with breakouts and acne. It's super common, and we need to normalize it because it is normal. We need to identify that these kids can and do care about it and give them the tools they need. In the case of girls, maybe they're using too many tools or the wrong tools. But in the case of boys, we need to actually provide them with things that are easy, can fit into their lifestyle, that are doable, that they feel good about and
Yeah.
aren't embarrassed by.
Yeah, yeah. So we'll get into Strike in just a minute, but tell me like on a very basic level for parent education and teen education, how many steps should our kids be going through with a skincare routine?
You know, honestly, the basics of any good skincare routine starts with simply washing your face. You will see clinical studies that show that just removing dirt and debris will improve your complexion, reduce breakouts. Starting with a gentle cleanser, I prefer things that are fragrance-free and hypoallergenic, even for teens, minimize that potential for irritation. But washing your face, preferably twice a day, is a great place to start.
Some
Sunscreen and sun protection, also a wonderful idea to start those really good habits early, protecting yourself from the sun, having a broad spectrum SPF sunscreen every day, especially if you are in a warmer climate or it is in the summer, avoiding burns and excessive tanning. That's a great time to talk about that with your teen as well. And then moisturizing, if the skin tends to get dry and they might need a little extra moisturizer, or if they have sensitive skin prone to eczema, really important to incorporate a moisturizer. So those are three really easy things that you can start with in a tween, all the way up to teens, and even for us, as adults, like, a basic
Yeah.
skincare regimen is really just that.
Yeah, yeah. Thank you so much for saying that because I think, sometimes parents can get overwhelmed. Certainly, I think well-intentioned professionals get overwhelmed at guiding kids, but they're not, I want to just say kids aren't going to do it if it's multiple steps, right? Or they're going to, especially boys, they are not going to do something if it's
That's
like a
my experience anyway, as a mom and Dr. Amy. I hate
yes.
to put people into stereotypes, but truly, this is my experience.
Yeah, yeah. I mean, I just know teens and they're not most of them are not going to do a 15-step process. So I love what you just said, a gentle wash, sunscreen daily, moisturize as needed, right? Okay. Now tell me why you developed Strike. And I mean, I'm so curious, right? Because you have all the knowledge and background to develop a really cool skincare line, I'm sure. Why is it different? And why did
Oh,
you decide to do this?
thank you for saying that, Dr. Amy. The four founders of Stryke Club, we have myself, who's a dermatologist, board certified pediatric dermatologist. We have a mental health professional. We have a licensed family therapist who was one of the founders whose, idea it was to start Stryke Club, being that she saw that there was a need and that boys' needs were not being met.
Mhm.
And then we have two other moms, one who is a CPG guru and another who is a serial entrepreneur. And the four of us really kind of came together on this mission to really make skin care and self-care cool for teen boys, remove the stigma, change the conversation about it, and give the tools needed to really make it easy, like one wash head to toe, that is very, very gentle, safe, effective, but contains an ingredient that helps reduce bacteria, so therefore helps with acne. And that's really the basis for the whole product line, is we have gentle things, mostly fragrance free, with an ingredient that helps to fight things like body odor and acne, because truly it is bacteria that can lead to and worsen both of those things.
Yeah, yeah. Okay, so I'm already as a mom and as a psychologist hearing something I love, which is like one wash for a boy,
Head to toe, yeah.
which is like so life-giving to me. I have to be honest. Yeah.
Mhm.
What else? What else is different about Strike Club or your products?
Really, I think it's the ingredients too that I carefully, it took me 2 years to formulate such a gentle combination of surfactants and using an ingredient that is really safe, fights bacteria, but doesn't have irritation, lead to dryness or bleached towels, like so many of the other acne
Amen.
out there, right? So we wanted to do something novel. There was really time for innovation in this space. And one of the products that I absolutely love, too, that we've created is a biodegradable wipe. And it's so awesome for kids who are active, athletes, throw it in the backpack. It does also contain that bacteria fighting ingredient. And it's a great thing to do if you don't, have a sink at the ready, if you are on the go between games and whatnot, you can't wash your face, at least you can wipe and wipe the inside of your equipment. So that we found is really, really helpful. And then we have a lot of things in the pipeline too. We have a new product, which is really those pimple patches. They're hydrocolloid dressings that you can put on. They're invisible. They are great because teens with acne may want to cover, but it also has the added benefit of promoting wound healing and keeping hands off so we're not picking, because that's another big issue that teens face when they have severe acne, or even just one or two pimples. It's hard to sometimes prevent yourself from picking, and if you pick or squeeze, you could end up with more scarring than if you allow it to heal. So that's a really important point for teens and for counseling, is please keep hands off. We really don't want you picking the acne. Try a pimple patch instead. I think that's a great thing to incorporate too if you're having an active breakout.
Yeah, and by the way, I'll just plug that. It's unsolicited by Dr. Sheila, but what I will say is we cannot extinguish a behavior without giving an appropriate replacement behavior, right? So in the world of psychology and change behavior, we can't ask our kids to stop doing something, but then not give them anything to do. So I love that you're saying stop picking, put this thing on instead of just saying
Mhm.
stop picking. So I agree with the principle.
Yes, yes, we need to change those behaviors, right? It's
Yep,
like,
yep.
you need to wash your face. Here's how to do it. Here's what to do. You have an active breakout. Here, why don't you use a spot treatment, put on a pimple patch, you're out the door. So there's lots of things that we can do to give our teens, boys and girls, the tools they need to help at home. And
Mhm.
then, as we talked about, if things are more severe and we think they might need more than just what's available over the counter, then we have our dermatologists or first line pediatricians to help out in those cases.
Yeah. So I feel like people learn really well through stories. Can you think of either your own tween boys or a patient that you've seen who's just developed a different kind of skincare regimen, or using Stryke products, either one that just has had a really great outcome?
Oh, I do have a good story. So, in pediatric dermatology, we see common things like acne and eczema, and we see the rare things like the genetic skin disorders. And I have a cohort of kids, and one in particular who has a genetic condition where the skin becomes very thickened, and it becomes thickened with little pockets, almost like a mole, but with little divots in there. And unfortunately, it can be very malodorous because bacteria like to live in these like areas of skin folding and whatnot. So this patient also, struggling with having a visible difference in their skin already, with this large birthmark all over their body, but then the added odor that it has. And we tried a lot of things, to manage this, from antibiotics, orally, topically. We tried diluted bleach baths, which I do with lots of my patients, which can really be helpful. And you know what? When I finally said, the Stryke Club wash has some sodium hypochlorite in it, it's antimicrobial. You might be able to get this child to use it head to toe in the shower. They came back, 3 months later saying this is the best thing that they've used to
Um,
fight body odor. And it just gave me such a great feeling, because I know that, something that we created has helped the life of this boy, and really cut down on comments and bullying due to, body odor that we all get, but, in some instances, it can be a little bit more severe.
yeah. Oh my gosh. I love that story. Thank you. I love teenagers, and they can be pretty harsh with one another. So I think that's the other thing that I'm hearing from you, right? Is that when we give kids tools that help them take care of their bodies, it also, gives them a little bit of a defense shield. Because kids can be kind of mean about appearance and odor and all those things. So that's a lovely story. Anything else that you would share about your experience with this, or how it's been affecting teen self-esteem or self-concept?
I might use this as an opportunity to segue into education, because I mentioned in my bio that my career has really been education focused. I've started really early on volunteering with my national society, creating like educational handouts, not only for the caregivers and the parents, but also for my peers who, again, may not have a lot of access to pediatric dermatology because we're a small subspecialty. And that led me to realize, the reach and the impact that you can have in different areas. And in the pandemic, when I saw colleagues taking to social media and doing a great job educating, and seeing the engagement from all age groups, and especially the younger age groups, the teenagers too, and the young adults that were watching, I thought, this might be a good opportunity. So I did actually take that plunge and decide, I'm going to try to use my experience to meet people where they are and to provide some education on social media platforms. And that was a really new avenue for me because I have been a slow, late adopter of social media. It's not been my favorite thing, Amy. But when I started to build my social media presence, I was very surprised at the response and kind of knew that as doctors, if we don't start getting into the conversation, because more and more people are getting their news from social media. That's their first, touch point with how they receive information. They're looking for health related information online and on social media. So as doctors, if we don't meet patients where we are and try to give them the educational points that they need, I think we're really missing an opportunity, because what I've learned from that journey is that the people that I'm trying to reach, they might not be on those websites looking at the handouts that I've
Yep.
made and carefully curated them with my, with peer reviewed groups. But you know where they are? They are on social media. So trying to provide that content too, to kind of round out how we can help and how we can provide great evidence-based, science-backed, information for people. That's a really important part of I think how doctors can be more relevant and affect more change.
Yeah, I think it's really important, right? Being good connoisseurs of information in any way, and knowing that either we're going to get out in front of it and message, or kids are going to find it and parents are going to find it through, influencers who really aren't specialists in any particular area, for instance, right? Like when it comes to
Right.
pediatric dermatology, we want to hear it from the source.
That's my opinion.
Yeah.
Yeah, because a lot of the dermatology and even health related information on social media is actually not coming from board certified experts.
Agree. Agree 100%. Well, as we're beginning to wrap up a little bit, I know we've talked about this a bit, but what's one thing that people are getting wrong about teens and tweens and skincare?
Some of it we touched on a little bit. I think we get it wrong when we fail to ask about it and then we don't address it.
Mm.
Ignoring a problem will not make it go away and will only make the teenager feel like they shouldn't, perhaps be feeling the the emotions, the negative emotions that they are. So we need to remember to it kind of comes back to name it to tame it. We have to identify and name and help and say, hey, if you're struggling with something related to something on your skin, whether that's a big birthmark, like a visible difference, or whether that's an inflammatory skin condition, we're there to help. And you can certainly be a really good partner and advocate for your teen when you actually open the conversation and start to talk about it.
I really appreciate that. Like anything else in your teenager's life, right? We don't want to just hope that it goes away, whether it's their skincare or their mental health or their physical health in any capacity. So thank you for saying that. What's one thing that's just giving you joy right now? What's one thing in your life that feels really life-giving?
One thing that has made the past 3 months so fun for me, Dr. Amy, is that both of my boys are in a travel basketball league. And so it's been so fun actually to see the growth and the fun that they're having. This is the first year that they've both done it. And to see the teammates and to see how kind and nice they are and all the great sportsmanship that I've observed, that gives me hope for, down the road with when my boys go to high school. And just knowing that there's just such a great cohort of tween boys out there. And I just have had the most fun, more than I thought.
Yeah, I agree. Teen boys are awesome. Um, this is a question I ask all of my guests. It's not hard by any means, but let's say it's 10 or 11 o'clock at night and you have a food craving. What do you reach for?
Oh, for me,
Yeah.
um, Oh, I'm gonna say almond butter and crackers. That's one of my favorite snacks. So at night, that's what I'll do if I'm really, really hungry. And I am also just a sucker for the sparkling water. I do love to have like a nice sparkling water before bed and, at dinner
Awesome.
too.
Awesome. That's super fun to know. Well, where can people find you, and where do they find you on Instagram and TikTok and all those things? And then how can they find out more about Strike Club?
Well, for Strike Club, we are available on Amazon and our direct to consumer site. So you can find us at www.strikeclub.com, and that is strike with a Y. So feel free to check that out. We are also on Amazon, though. For my social media on TikTok, I'm Dr. Sheila, and my name is spelled a little differently. It has a GH at the end. And then on Instagram, I'm dr.sheila.m. I also would love to put a plug in for my national society. I'm the acting president this year, and I think we've done just a great job. Like we talked about, kind of curating awesome educational tools, not only for parents and, you know, um, caregivers, but also for our peers in primary care. So if you go to www.pedsderm.net, you'll find a whole host of resources, handouts on many of the most common and even some of the rarer skin conditions that kids, from babies all the way up through adolescents are facing. So it's a great resource for not only parents, but also other healthcare professionals who might be listening.
Awesome. Okay. So, friends, we will put all of those assets in our show notes today, how you can find Strike Club, how you find Dr. Sheila on socials, and Peds Derm, so that you are in contact and getting information from the experts at hand, which both Dr. Sheila and I agree is really, really important to get information from trusted sources. So thank you so much. I really appreciate the work that you're doing in the world. I think it goes well beyond skincare and into how kids really feel about themselves. So I really appreciate the work you're doing.
Thank you, Amy. It was great talking to you.
You as well.